Hello and welcome. I am Ramesh Ramachandran. It's good to have you again with us. Now, you're watching a special broadcast here on DD India. We're calling it #Tracking COVID-19. Remember, DD India is your one-stop destination for all information related to COVID-19. And it goes without saying, we at DD India are taking particular care to give you, the viewer, accurate, authentic and authoritative information so that you don't fall prey to rumors or fake news. Now, trust me, wherever in the world you might be, it is in your interest to follow advisories, protocols, or guidelines issued by the authorities concerned. So stay at home, maintain social distancing, use masks or gloves, and wash your hands regularly with soap. All right, let's get started. First up, the headlines. "92 cases of COVID-19 and 4 deaths reported in the last 24 hours. Centre reiterates steps to counter spread of COVID-19 to continue in the country to achieve desired results, says India still under local transmission mode. Appeals to people to keep on rendering cooperation in the fight against the deadly virus. Prime Minister Modi interacts with leaders of social and spiritual organizations, urges them to spread awareness about the disease and help with volunteers on the ground. ICMR approves first indigenously developed coronavirus test kit. Test to cost 1,200 rupees as against the present cost of 4,500 rupees per test. DRDO says it has devised indigenous equipment including multiple-use ventilators and isolation tubes to fight COVID-19 pandemic. The worldwide confirmed fatalities from the novel coronavirus rises to 35,000, while corona-positive cases touches 7 lakh. Italy, Spain, US and France most affected. All countries take steps to deal with COVID-19. All right, let's now take a look at how the numbers stack up in India and around the world. First, as always, we begin with data shared by the Ministry of Health and Family Welfare. Let's take a look at the numbers from India first. We'll pull up the graphic on the walls so that you get a perspective on where things stand as we speak. All right, first up is a number from India where the number of cases has risen to 942 as on date, and 69 people. In fact, we can get the number, 29 deaths reported in India so far. And if we go to the next graphic, there are 99 discharge cases as well from all over the India as on date. So that's the India at a glance. Next up, we have almost 1.5 million passengers have been screened at the airports across India, although flights have all been grounded. Now, the highest number of cases reported is from Kerala at 194. Next up, we have the second highest number of cases from Maharashtra. That's at 193. Right, next up, we have the largest number of deaths reported from Maharashtra at 8 deaths. So that's India at a glance for you. Next up, we have some more data from India, which will give you an idea of what has changed over the last weekend, over the last couple of days. Now, on 20th March, the cases of active COVID was 775. Today, it is 942, so an increase of 167 active COVID-19 cases. The number of deaths, it was 19 on 28th March. Today, it is 29. The number is increased by 10 deaths in the last 24 odd hours. Next number is of discharge cases. That was 78, today it is 99, the increase of 21 discharge cases across the country as we speak. Right, moving on, the passenger screen at airports, the number remains constant because flights have all been grounded across the country. No flights are taking off or landing during the lockdown period. That's what the data says from India. Let's look at what has happened in India across the states. Now, the highest number of cases has been reported from Kerala at 194. And Maharashtra comes a close second at 193. So Kerala overtakes Maharashtra in the number of cases reported across the country as we speak. Right, next up, we have the world at a glance. There are 6 lakh cases and counting of confirmed cases across the world as we speak. These are data collated by the WHO. Next up with the number of deaths, which has shot up to 30,000 and counting as we speak around the world. Right, moving on, we have the almost more than 200 countries affected by the coronavirus in the world today. That's world at a glance for you. Next up, we find out what has changed in the last 2 days. The confirmed cases have shot up by nearly 1,25,000 in the last 2 days alone. As you can see on the screens right now, it shot up by 1.25 lakh in just 2 days. Number of deaths again increased by almost 6,000 plus between 28th March and 30th March in the last 48 odd hours. Right, moving on, we have an increase of 1 country or territory in the last weekend or so. So that gives an extent of the spread of the coronavirus across the world as we speak. Right, one last data I want to share with your viewers is the number of cases reported per day across the world starting in January and ending on 29th March. There you go. So we begin on 23rd Jan, 574 cases, rising all the way up to 66,000 on 29th March. That's the one-day case study as reported by WHO in just 1 day on 29th March, number touching almost 67,000 figure. All right, that's the world information for you. Right, now the Health Ministry says that we have 92 new cases of COVID-19. 4 deaths have been reported in the last 24 hours, taking the total number of cases to 1,071 and 29 deaths in the country. An official says the battle will be successful only if 100% test result is achieved. Take a look. Right, let's now get you a ground report from across the country as we speak. We'll begin in the north. In Jammu, police have enforced a complete lockdown. Shops are shut. Public transport is completely off the roads. Ramesh Venna reports from Jammu. Take a look.
This is one of the busiest markets of Jammu where I am standing today. But today, due to this lockdown, the markets are wearing a deserted look and all the shops are closed. Nobody is seen moving on the roads. Only some shops which are selling some essential commodities, they are open. Like here is a milk shop. It is open here, and we can see a ready wala which is selling fruit. It is police. They are strictly enforcing the lockdown, and only those people are being allowed to move who are going to purchase some essential commodities like vegetables, fruit, milk, etc. We can see here that vehicle is plying here. There is no movement of people. Only few people are coming here. What the police is doing here, all the vehicles which are coming here, they are stopped here. They are being asked that why they are moving out, and if they are having valid pass and if they are having any valid reason for moving out, only then they are being allowed to move. So we can say that police is strictly enforcing the lockdown to prevent this spread of coronavirus. R.K. Rana for DD India from Jammu.
Right, to the east now, Meghalaya, a state with 0 cases so far, is taking the lockdown very, very seriously. All its efforts are currently focused at keeping the state free of any infection. Here's a report on the measures in place in the state.
It's day 6 of the 21-day countrywide lockdown, and here in Meghalaya, the state government is treading a cautious path. As you can see, all stores in the Police Bazaar in Shillong are closed. Even stores that sell essential commodities have not opened today. The only open store is a pharmacy where, as you can see, people are strictly following social distancing as they're procuring their medicine. It must be mentioned that the state government did experiment opening the stores on both the 27th and 28th. However, appeals for social distancing received responses that can be described as lukewarm at best. In certain areas, people followed social distancing and were in orderly queues, but in certain others, people crowded up and flouted all rules which were related to social distancing. Now, and today, the government has set up a meeting with the Rangbashnongs, or local headmen of various localities in East Khasi Hills. This is so that they can better facilitate the opening of grocery stores tomorrow on the 31st. The Rangbashnongs are a very important cog in the whole machinery when it comes to implementation of any scheme. We're here with Sri Sebastian Swe, the Rangbashnong of Vishnupur locality. He's just attended a meeting with the government of Meghalaya and they had discussions on reopening of markets tomorrow. Sir, how fruitful were the discussions with the government officials?
Government, from the side of government also, they have suggested to the headmen to examine this idea. It was implemented successfully in these two localities so that people does not come out. There will be home delivery through the volunteers of the locality, and they can place order by WhatsApp or by telephone number. Headman will see that it is distributed door to door to all the households within the locality.
Now we get a report from Maharashtra in the west, where Chief Minister Uddhav Thackeray has set up more than 200 relief camps for providing shelter to nearly 71,000 migrant labour or the homeless to ensure that they have food and a roof over their head. My colleague Shishir Shelar reports from Mumbai. Listen in.
Well, the Maharashtra has recorded the highest number of corona positive patients, and that's the reason the government is taking ample care and have been taking various steps to reduce the number here. As far as the cities are concerned, the city has been, the government have taken ample precautions to disinfect the city. At the same time, the police force have also been deployed at various locations because the police have been telling people not to come out of the road. But in spite of that, we have seen at some locations people are coming out in large number, and that's the reason this kind of police force have been deployed at various locations where police have been asking people the reason why they're actually on the roads here, and the reasons they're also telling them not to come out in large number, and that's the reason the SRPF team has been also been deployed at various locations across Mumbai and Thane regions where police have been doing their work. Well, in spite of that, we've also seen that the disinfectant actually been sprayed across the city, be it Mumbai, be it Thane. Many private organizations have come in forward to give support to the municipal corporation in this regard. At the same time, those who have stuck in Mumbai and their adjoining areas and in Maharashtra, the various organizations have come in picture and have also extended their support as far as the food packets are concerned, the food grains are concerned, have been supplying by the authorities also, and as well as some of the organizations have concerned, large numbers, they are also supporting the people who are stuck in Mumbai. Obviously, at this point in time, government authorities have been telling people that not to come on the roads. Social distancing is a major reason that they have to follow, and it seems that what people actually is also following it. The roads are cordoned off, but still the few elements we can see on the roads, and police is actually taking action against them across Maharashtra. In Mumbai, Shiv Shila for DD News.
In another ground report from Western India, my colleague Vishal Baristo reports from Rajasthan's capital Jaipur. Listen in.
I'm on the Jhotwala road of Jaipur, and as you can see, police are finding it very hard to somehow stop people who have one or the other excuse to break the lockdown. As you can see, these people, they have come out and police are trying to tell them to stay indoors. We have been trying to talk to people and tell them to stay indoors. It's not about migratory workers, it's all about the local people of Jaipur. This road takes you to the walled city where curfew has been imposed. And that includes 7 police station areas of the walled city. All we can say is stay indoors, stay safe for your own security, for your own safety, and yes, for the country. With cameraman Hanuman in Jaipur, this is Vishal Baristo, DD News.
And finally, to southern India. Now, work from home is not a new concept to the IT industry, but now it's slowly catching on in other sectors. My colleague Aisha Khanam reports from Bengaluru. Take a listen.
IT capital of India, Bangalore city is observing total lockdown. After 3 deaths were reported in the state, the Karnataka government has strictly implemented lockdown across the state. Just 80 kilometers away from Bangalore, there are 2 districts, Gauribidnur and Chikbalapur, where there are increasing cases of COVID-19. Therefore, the government has declared medical emergency in these 2 regions and also sealed the borders across these both districts. The government is taking care of the migrants and providing them shelter and giving them food and also medical kits. Besides, the Bangalore City Corporation has opened over 31 fever clinics because there was panic among the people when they saw symptoms of fever and common cold in them and rushing to check whether it was coronavirus. So the fever clinics are functioning around the clock to help people allay their fever doubts and also to tell them that they need not worry about fever. The government is also implementing lockdown in many regions across the bordering areas with other states, and it has also successfully managed to bring the laborers from Maharashtra into Karnataka successfully, although the other laborers in Karnataka are being given shelter in many places. The government says the lockdown period will be decided based on the response by the people and how they respond to this lockdown and how they take up this responsibility. Although the central government has said that the lockdown may not be extended, but the state government cautions the people that the decision will be taken based on the behavior and the responsibility of the people in the state. Asha Khanam, DD News.
Right, moving on. Indian Health Ministry says 92 new cases of COVID-19 and 4 deaths have been reported in the last 24 hours, taking the number of cases to 1,071 and the number of deaths to 29 in the country. The official says the battle against COVID-19 will be successful only if 100% result is achieved. Even a 99% rate will not ensure success.
कोई भी एक व्यक्ति लापरवाही करता है तो अब तक का जो हमने रिजल्ट पाए हैं, अब तक जो हमारी रिलेटिवली पॉजिटिव स्टेज है, हम फिर से जीरो स्टेज पे आ सकते हैं, हम फिर से फेल हो सकते हैं। तो इसलिए मैं आप सबसे रिक्वेस्ट करूंगा कि हम लोग हर तरीके से 100% अलर्ट रहें, 100% एफर्ट रखें कि जो गाइडलाइंस, जो डायरेक्शंस और जो डूज एंड डोंट्स सरकार की तरफ से पब्लिक में हम सबको बता रहे हैं, कृपया करके उन गाइडलाइंस का 100% अमल हो। हम इसमें 99% भी अमल जो है वो हमारे एफर्ट्स को फिर से हमें बेकार कर देगा। इसके लिए आप सबका सहयोग हमारे लिए बहुत जरूरी है।
Right, now here are some advice from doctors. Listen in.
I am Dr. Shishir Jain, senior pediatrician. I just wanted to tell you that in cases of corona endemic, we should especially care the extremes of ages. That means under 10 years and more than 65 years of age group. Because these individuals have the low immunity level, and to fight against corona, we need a very good immunity. More than 65 years age pupils are having less immunity, and if they are suffering from some other diseases like hypertension, diabetes, and some cancers, HIV, etc., they need much more care. Similarly, children below the age of 10 years, they also have the low immunity levels. They also need very, very special care. They should not be allowed to come, and we should take care of our health workers. Our health workers, which are doing day and night work for the patients and the others, they should be provided the gadgets, masks, aprons, and especially they should be provided with PPE, that is personal protection equipments. If we have these personal protection equipments, we can fight against corona. We should follow the social distancing, we should wash our hands frequently, and we should follow the advice of our Prime Minister, PM Modi ji.
The whole idea about the COVID-19 is awareness, awareness, and awareness. And two things I would like to mention very categorically. First of all, social distancing. And second is respiratory hygiene, and maybe third is hand hygiene. Three things are the key to contain the contagious state. One more important thing, if by chance you happen to visit a contact or a nursing home, I being a doctor, happen to visit the nursing homes to attend my patients, I need to put up my separate clothes and go and have a good wash, maybe a bath also. I should retain all my enclosures, maybe my keychain, my wallet also. at a distance before entering into the house. If India wants to retain itself into the stage 2, then the key important thing is more of tests. Earlier the tests, you see the difference between Korea and US. Both of them were tested equally, but Korea could do it early. They could contain early. Social distancing, isolation, and self-quarantine is the key to success. We can definitely defeat the pandemic of COVID.
I'm Dr. Rakesh Gargar. मैं एडिशनल प्रोफेसर हूँ एम्स न्यू दिल्ली के अंदर. Right now I am working at NCI Jajjar, which is taking care of the patients who are suffering from COVID or their suspect cases at an isolation center. The first important part is, though we have a pandemic of COVID-19, which is also known as coronavirus, but it's not the time to panic. We have to take care of ourselves so that we can defeat this happening of COVID-19 spread, and we all can do it. We have to follow certain things, which is very, very essential, and if we follow them diligently, the chances of spread of disease will be very, very less. The first and foremost important thing is the hand hygiene. When we say that the infection spreads through fomites, we have to be careful that rather than handshaking, a namaskar will be a good one, and touching the items which are surrounding you, if you can avoid them, it will be very, very good. But chances are there that we can touch some of things. So what we can do in those situations? The best part will be maintain good hand hygiene by having a good amount of hand wash using soap and water. You can also use alcohol-based rub. That will be equally good. The social isolation is need for the day. If you can stay at home, it will be good for not only for you, but for us also as a healthcare provider, because we want your safety, we want your health, and that will be one of the greatest contribution from you. If you can stay at home, if you can stay at your family, it will be a huge impact in stopping the infection from one to other. So please maintain it. Now, to surprise, there are many rumors which comes on the social media. Beware. We have sites which are available on the social media from various reliable agencies like government, like medical science fraternity. Now, the good part of the disease that we are seeing as a medical fraternity in India, that not many patients are very sick. Usually the symptoms are coming to be mild, that's a good thing, and it does not require a good amount of medication or varied medications. The only treatment would be symptomatic management. Stay at home, get quarantined, be away from your family members, and that is what needs to be done. In case of any doubt, we have the helpline numbers. Doctors are sitting there. They will be guiding you what to do and what not to do.
Now, over 70% of Indians are worried that they or someone from their family may get infected by coronavirus, according to a snap poll conducted by Gallup International Association and Impetus Research. That's higher than the world average of 67% in 26 countries, the poll reveals. The scare of the pandemic has disrupted life over the past few weeks. The survey was conducted by Gallup across 26 countries in an exclusive first global poll on COVID-19 amongst a sample size of more than 24,000 respondents. In India, Impetus Research, partnered with Gallup, conducted a survey over phone and online in the past 2 weeks. In India, as many as 83% agreed that Prime Minister Modi's government is handling the coronavirus crisis well. People across the world do not know what they expect in the weeks to come, but 60% in India are much more optimistic than the rest of the world. In India, people are taking precautions to help prevent the spread of the coronavirus. The most common precautions are washing hands frequently at 82%, medical masks at 70%, using hand sanitizer at 64%, and over 60% are staying in their home or self-quarantining. That was all the news from India. Now take a look at what media in South Asia and around the world are reporting about. Tolo News is talking about the lockdown enforced by the Kabul police in the capital city. All right, moving from Afghanistan now to a neighboring Pakistan, where the Dawn newspaper has a dashboard on its website. Moving from Pakistan now to Nepal, we have the Kathmandu Post, which has on its front page the story about the nationwide lockdown extended till April 7th midnight and a ban on all international flights until 15th of April. Right, moving to the Bhutanese, published from Bhutan, which has on its front page a story about how civil servants have decided to contribute 5 to 10% of their salary. Moving on to Sri Lanka now, where we have the Daily Mirror publication. And the Daily Mirror has a story which says that in the Easter services, including Maundy Thursday on the 9th of April, Good Friday, Holy Saturday and Easter Sunday on the 12th of April, will be cancelled in Colombo, Gampaha and Kalutara districts. And the Rajya TV of Maldives has a dashboard which gives a number of the COVID-19 patients. It says the confirmed cases in Maldives is 17 as of 30th March, and there have been 0 deaths so far in Maldives. Let's go to the South China Morning Post, published from Hong Kong, which has a story about Chinese President Xi Jinping's visit to Zhejiang, and it says that this is one of his rare visits outside of Beijing in the... Right, that's a wrap on this special broadcast, but news continues here on DD India. You can catch all the latest updates on our social media, mobile and digital platforms. Thanks for watching. Bye-bye.